Okay, today we're tackling something that is, without a doubt, a full-blown crisis. The state of mental health services for young people right here in the UK. We're going to go straight to the sources to figure out what's really going on, the pressures on the system, the people on the front lines, and what a whole new wave of research is telling us about this emergency. Right, let's get into it.
And really, this is the question that frames everything we're about to talk about. The data we're seeing shows a system that's under an almost unbearable amount of pressure. We're talking about a safety net that's been stretched so thin, it's just tearing. I mean, we have tens of thousands of kids, over 78,000, who've been waiting more than a year just to get help. It's staggering.
And this really sets the scene. Since the pandemic, we've seen a 77% explosion in referrals to children's mental health services. But what's fascinating and kind of worrying is that it's not just the sheer volume, it's the nature of the demand that's changing, which is leading some to ask a really tough question. Are we accidentally starting to medicalize totally normal everyday struggles?
So first up, let's just get a sense of the scale of this crisis. And we're not just talking about a few little cracks here and there. No, this is a fundamental problem where chronic underfunding is colliding with this absolute tidal wave of demand. A demand that's getting more and more complex, and it's putting services across the country on the ropes.
Just look at how fast this has happened. In only 4 years, the rate of probable mental health problems shot up from 1 in 9 to 1 in 6. But the research is pointing to something much bigger than just rising illness. Psychologists are talking about this idea of concept creep, where our definitions of what counts as harm or a disorder just keep getting wider and wider. And at the exact same time, you have social media algorithms feeding kids content that leads them to self-diagnose, sometimes even unconsciously modeling symptoms like that whole TikTok tics phenomenon. So yeah, this isn't some slow creep, it's a massive acceleration that's caught the system completely off guard.
And this really just lays out one of the biggest injustices in the system. Depending on where you happen to live, the mental health spending on your child could be as little as 14 quid or as much as 191. Now compare either of those numbers to what's spent on an average adult, 225 pounds, and you can see this huge, troubling gap. The care a kid gets is basically a postcode lottery. It's as simple as that.
And here's the crucial point. When these specialized youth mental health services can't cope, the problem doesn't just vanish, it has to go somewhere, so it spills over. Young people who are in deep crises end up in A&E or on general hospital wards, places that, often just aren't set up to give them the specific help they need. And that just creates this domino effect, piling even more strain on the entire healthcare system.
So who is actually dealing with all of this on the ground? Well, behind all these systemic failures, there's a workforce of incredibly dedicated people trying to hold the whole thing together. Let's take a look at the amazing skill of mental health nurses and the really sophisticated art of care they're trying to deliver in this incredibly tough new environment. At the absolute core of what they do is something called therapeutic communication. Now, this isn't just about having a nice chat. It's a deliberate, highly developed process. The whole point is to empower the patient so they can understand and actually take part in their own recovery. And you can imagine how important that skill is now when a young person might walk in already convinced they have a specific diagnosis they saw on social media.
So just imagine this scenario. You've got a patient who's being defensive. They're in denial. This is a real flashpoint, right? If you go in with a confrontational approach, you could just shut that conversation down for good. So what does this skilled nurse do instead?
They do this, and it's brilliant. This is a perfect example of a technique called motivational interviewing. See how the nurse doesn't argue? Instead, they gently hand the power right back to the patient, and they ask them to connect the dots between their actions and their own goals. It's completely non-judgmental, it's respectful, and it's just so much more effective at helping someone see things for themselves. And the skill doesn't stop with words. It's even in their body language. The Solar method is basically a little cheat sheet for a whole set of actions designed to build trust and just show that you're engaged. Every single part of how a nurse interacts, from their posture to their eye contact, it's all a deliberate therapeutic tool. But what happens when the people who've mastered this are themselves in crisis? And that brings us right to the heart of the personal and professional challenges these frontline workers are up against, as the strain on the system takes a really heavy and deeply personal toll on them.
The challenges are coming from all sides. These incredibly important jobs are so often undervalued and underfunded. That, of course, makes it tough to recruit new people and even harder to keep the experienced staff who are just burning out from the pressure. And on top of all that, you've still got the societal stigma around mental illness. And we're hearing from staff that any efforts to support their well-being just feel tokenistic, like putting a little Band-Aid on a gaping wound.
And right at the center of their day-to-day work is this massive ethical battle. On one side, you have autonomy. You have to respect a patient's right to make their own choices. But on the other, you have beneficence, the duty to do what's best for them and stop them from getting hurt. So what on earth do you do when a patient is choosing a path that you know for a fact is going to cause them harm? This is the tightrope they walk every single day.
And sometimes that conflict escalates to a point where physical restraint is the only option left to keep someone safe. The psychological hit on staff from that is just severe. The sources we've looked at showed they report these intense feelings of guilt and sadness and even failure, which goes against the very core of who they are as carers.
In this line right here, this is the one that connects everything. It's not just some internal problem for the workforce. Poor staff morale has a direct, real-world negative impact on the quality of care that kids and their families actually get. The well-being of the care and the well-being of the patient, they are completely, totally linked.
Okay, but it is not all doom and gloom. Not at all. Buried inside all this crisis, the reports we've seen highlight some incredible, innovative work and some really positive change. So let's look at what's actually working.
Check this out. An organization called Center 33. They were having huge problems with staff retention. So what was their solution? Instead of the usual top-down management style, they basically handed power over to their teams, getting them directly involved in shaping the organization's strategy. It creates a sense of ownership and empowerment, and guess what? It makes people want to stay.
And here's another really clever bit of collaboration. An organization called Young Devon partnered up with Statutory Services. They managed to get free clinical supervision for their therapists, which is normally super expensive. And the result? They were able to boost their capacity, take on more kids, and take some of the pressure off the official child and adolescent mental health services. I mean, that's a true win-win.
And get this stat. This one is fantastic. There's an organization called Navigo CIC. They had a staff sickness rate of over 6%. So they gave their employees a vote on policy changes. The staff chose a new policy, and what happened? The sickness rate dropped to below 2%. It's just such a powerful example of what happens when you actually trust and empower your people. You get incredible results.
So we end with this question, which is really the most critical one. The problems facing youth mental health services aren't just one thing. They're woven into the very fabric of our healthcare system, our schools, our social media world. So the solutions, well, they have to be just as interconnected. This isn't just about throwing more money at the problem, it's about empowering the workforce, it's about smart collaboration, and it's about fundamentally rethinking how we as a society define and support the mental well-being of our next generation.